Today we are going to talk about the first heart sound, and pattern of the lecture will be, the format of lecture is, first of all we'll talk about the basics of the first heart sound, basic concepts, and then we'll talk about clinical correlations. In the basics, first of all we'll talk about what is the genesis of first heart sound, how the first heart sound is produced. Then we will talk about the features of first heart sound. For example, what is the duration and what is the frequency or pitch of the first heart sound. And then of course we'll talk about its auscultation. What are the best area on the precardium where this sound is heard best, first heart sound and its components. Once you are clear about this concept, then we will go to the clinical correlates, right? For example, what are the conditions which change the intensity of first heart sound? What are the factors which affect the intensity or the loudness of first heart sound? What are the clinical situations which will lead to loud first heart sound or soft first heart sound, or variability from beat to beat, variable intensity of the first heart sound. And in last part of the lecture, we will talk about that, yes, first heart sound splitting. Remember, splitting of second heart sound is more important to understand, and intensity of the first heart sound is more important to understand. But still, we'll talk about splitting of the first heart sound and in which condition this splitting occur. Let's start with the basis first, genesis of first heart sound. To understand the genesis of first heart sound, let's start with the mechanical events in the heart which produce the first heart sound. Here I am drawing the right heart. You know these structures. Here is superior vena cava, inferior vena cava, atria, and yes, here is tricuspid valve, and this is pulmonary valve. And here is your left heart, right? And this is your aorta. Now here is your which valve? Mitral valve, and here is aortic valve. Now let me, of course, left ventricle is far more powerful and thicker than the right ventricle. Left ventricle is about 1/3, yes, right ventricle is 1/3 of the thickness of the left ventricle. Now, first of all, we will talk about the valves, right? You must, before you understand the heart sounds, you must know the valve. Here is which valve? Mitral valve, right? And here is, what is this? Tricuspid valve. And I will make here, yes, what is it? Aortic valve, and here it is pulmonary valve. Now basically heart sounds are produced by the mechanical events of the cardiac action, right? Now, first of all, how the first heart sound is produced? First heart sound is produced when there is onset of ventricular systole. When ventricles start its contraction, right? Let's suppose we put it here that this is the timeline, and here is ventricular systole, ventricle contract. Here is ventricular diastole, ventricle is relaxing, and then here is again ventricular systole and ventricular diastole. What I'm saying, if you start the time here, during this time, what is happening? Ventricles start contracting. Now, when ventricles start contracting, suppose we take it 0 time here, when ventricles start contracting, both of the ventricles start contracting almost simultaneously, right? Now, what will happen? When ventricles are contracting, pressure in the ventricle will go up, right? I will just show left side of the heart in this diagram, but you should remember there is right counterpart as well. Now, let's suppose this is at the beginning. I'm going to draw it here. Yes, at this very moment, what is happening? That aortic valve is closed, right? Just before the ventricles start contracting, actually, what was happening? Blood from atria was coming to the ventricle, and ventricle was filling. Is that right? And when ventricles start contracting, intraventricular pressure goes up. Intraventricular pressure goes up. And when intraventricular pressure is going up, right, as soon as intraventricular pressure is more than intraatrial pressure, whenever intraventricular pressure, as soon as it gets more than the intraatrial pressure, what will happen? Blood in the ventricle will try to go back to the atrium. And when it will try to go back from the side, blood will push and mitral valve will close. Mitral valve will close. Right? Again, I will repeat. When ventricular systole start, intraventricular pressure start rising. For example, from 0, pressure is going up. If pressure here is 5 millimeter of mercury, as soon as here is 6 millimeter of mercury, right, blood from the ventricular chamber will love to go back to the atrium. But when it will try to go back to the atrium, these valves will close. What is this valve? Mitral valve. But here mitral valve will close at the same time, almost same time, on the right side. Which valve will close? Tricuspid valve will close. Right. When both of these valves will close, now I will show exactly what mechanisms occur. During this time, when ventricle started contraction, its pressure went from 0 to 6. This valve closed. But at this time, this aortic valve is, at this very moment, it is also closed because pressure in the atrium, diastolic pressure in the atrium, aorta, diastolic pressure in the aorta is around 80 millimeter of mercury. And diastolic pressure in the pulmonary artery is how much? About 15 or 12 or so. Is that right? Even 8. But whatever is there, the thing is that when ventricles start contracting, pressure start going up, right? First of all, it will close this atrioventricular valve, right? On left side as well as on the right side. And after that, ventricle will keep on contracting and squeezing the blood. And keep on contracting and squeezing the blood until pressure in the ventricular chamber become more than aorta, right? Or pressure in the right ventricular chamber become more than the pulmonary artery. Then actually aorta and pulmonary valve will open. This is the first thing to understand, mechanical events, that when left ventricle start contracting, intraventricular pressure goes up. As soon as intraventricular pressure is more than atrial pressure, it closes the mitral valve, and here it closes the tricuspid valve. Then still it keep on closing as a closed chamber. No blood is coming in, no blood is going out, right? So it is isovolumetric contraction until ventricular chamber pressure become more than the major arterial pressures, and eventually aortic and pulmonary valve open. Is that clear? Now, where the first heart sound is produced? In simplest term, we say first heart sound represents the closure of the mitral valve and tricuspid valve. But it's not that simple. Classically, previously we used to think it is just at the onset of ventricular systole, just closure of these valves produces a first heart sound. This is old concept. Now we believe the truth is more than this. Even though first heart sound represents the closure of the atrioventricular valve or closure of the mitral and tricuspid valve, even though we say first heart sound is associated with the closure of mitral and tricuspid valve, but true mechanism is more than this. Let me explain what is the exact mechanism of genesis of first heart sound. I will just show the left chamber. I will just show the left heart. Right? Here aortic valve is closed at the onset of ventricular systole, right? Now here I am drawing the mitral valve, and its component. Mitral valve and its component. Actually, mitral valve has the leaflet. It has annular ring. Annular ring. It has annular ring in which the valve cusps are attached. Right? And then it has chorda tendineae, and they are in the end having muscles, which are, what are these muscles? Yes, papillary muscles. Is that right? And here is your left ventricle. Now, how the first heart sound is produced? When left ventricle contract, pressure in the ventricle goes up, it pushes the blood backward to the atria, but actually, when it is pushed backward, it closes these leaflets. It closes these leaflets. Okay, let me make the leaflets green color. It closes these leaflets. Right? But simple closure is not producing sound. Story is more than this. When it contracts, pressure goes up, it closes the leaflets. Leaflets of the mitral valve, it's about 5 centimeters square. These leaflets are very relatively weak. So there is a tendency that these leaflets will bulge back to the atrium. When pressure down goes up, this pressure will push the leaflets to the atrium. Is that right? But actually chorda tendineae are attached there so that these leaflets are like this. They don't evert like that. So what happens? Pressure here goes up, pushes the leaflet backward. Leaflet approach each other. Initially, before the contraction, leaflets were here. You get it? This position and this position. Suppose A dash. But when pressure goes up, leaflets move towards each other and they close. But the problem is that pressure here is so rapidly rising that leaflets may evert, and nature does not want this. So what happened to prevent the eversion of these leaflets? There is chorda tendineae and papillary muscle. So at that very moment, papillary muscle also contract. When ventricle is contracting, papillary muscle also contract, and chorda tendineae become little taut. They become little taut, right? And when they are little taut, right, chorda tendineae, then once the leaflets are closed, right, leaflets are bulging towards the atria backward, there is a pull on the chorda tendineae, and chorda tendineae stop the undue bulging of these leaflets and prevent the, you can say, mitral valve regurgitation. You are understanding? Again, if these are the leaflets, remember, there is an anterior leaflet of the mitral valve which is a bigger leaflet, and posterior leaflet which is smaller leaflet. But anyway, when pressure goes up, both leaflet approach each other. But intraventricular pressure with further rise, there is a chance that they will bulge too much in the atrium and evert. But nature prevents this accident by pulling it down by chorda tendineae and by the contraction of papillary muscle. Now, these leaflets are elastic. Chorda tendineae are also elastic. So what will happen? Leaflets will bulge up, chorda tendineae will pull down. Is that right? Or you can say that leaflet will bulge backward to the atria and chorda tendineae will pull it forward to the apex. Here is the apex, right? And due to this reason, vibrations will start. What will happen? These leaflets will start vibrating. Why they are vibrating? Because intraventricular pressure and the blood is pushing it towards the atrium, and chorda tendineae are pulling it to apex. So vibrations start. Now when these leaflets start vibrating, this is the first thing. When leaflets start vibrating as a diaphragm, you know, what will vibrate with them? The whole blood column. The whole blood column, this blood column, whole this blood will vibrate along with the leaflets. And even ventricular walls will also vibrate. Adjacent chambers will also vibrate. Even these vibrations which are set by the closure of mitral valve and tricuspid valve. These vibrations which are set by the or initiated by the closure of mitral and tricuspid valves, these will lead to, yes, vibration of the blood column in adjacent chambers, and vibrations also lead to the vibrations in ventricular walls, cardiac chamber walls, and also to the major arteries. So whole cardiac apparatus will vibrate. The whole cardiac apparatus will vibrate. These vibrations will be transmitted through the tissues to the chest wall. There they can be heard as first heart sound, where these vibrations can be heard as first heart sound, because this is the first sound which is classically heard at the onset of ventricular systole. Why it is called first heart sound? Because it is the first sound which is heard at the onset of ventricular systole. I remember once I asked a student that when did you hear your first heart sound in your life? Okay, when did you hear your first heart sound in your life? You don't remember. That old student became a little shy. I said, please tell me. He said, it was with my girlfriend when I first time hear first heart sound, right? So I will not mention about that. For many people they hear there, but what I want to say is you should hear with the stethoscope, right? So first heart sound is representing the, now listen, first heart sound is representing the closure of mitral and tricuspid valve. Or it is, why, how it occur? That when ventricular systole start, intraventricular pressure start rising, it push these AV valve from open position to closed position. Is that right? And after that, these two leaflets become like a diaphragm, and rising intraventricular pressure is pushing this backward towards the base of the heart, and chordate and they are pulling it to the apex of the heart, and these structure vibrate. I'm repeating it. So what vibrations? Closure of AV valve, closure of AV valve. AV valve mean atrioventricular valve, mean mitral valve and tricuspid valve. Closure of mitral and tricuspid valves sets the vibrations. In which component? Number one, taut valve leaflets. Valve leaflets. Number two, blood columns in adjacent cardiac chambers. Blood columns in, yes, adjacent cardiac chambers. Blood here and there, here all blood will vibrate. But especially blood in ventricles will vibrate more, because blood in the ventricle is tightly held, right? Thirdly, vibrations of ventricular walls or cardiac chamber walls. Vibrations of cardiac chambers walls. Is that right? Cardiac chambers will also vibrate. Especially in this case, both ventricles will vibrate. Is that right? And major arteries, which are aorta and pulmonary, right? All of them will vibrate. So when whole this apparatus will vibrate, valve will vibrate, blood column will vibrate, ventricular walls will vibrate, and associated arteries also. All these vibrations, right, will be picked through the tissues. It will reach to the chest wall. There, if you apply the stethoscope, you can hear it. And because this sound, which is initiated by the closure of AV valve, is the first sound which is heard at the onset of ventricular systole, so this is called first heart sound. Is that right? But remember, first heart sound has two components. One is mitral component, other is tricuspid component. So we say first heart sound, which is called S1, right? It has two components, mitral component, M1 plus T1. Now, when ventricles, both of the ventricle contract, actually pressure in the left ventricle rises more rapidly than the pressure rises in right ventricle. As you know, left ventricle is stronger than the right ventricle. So as pressure rises more steeply, more rapidly in the left ventricle than the right ventricle, so actually mitral valve closes slightly earlier than the tricuspid valve. You understand it? As left ventricle is stronger than the right ventricle, pressure start rising in both ventricles almost simultaneously, but it rises more rapidly in the left ventricle than the right ventricle. So mitral valve vibrations start slightly earlier than the tricuspid valve. So there may be slight difference sometimes in 50% of normal population. And 50% of the normal population, this separation of sound, first mitral component, tricuspid component, may be audible as independent or separate entities. Then we say there is some degree of splitting in the first sound. Now, so we can say here that first heart sound came due to the onset of ventricular systole. So this is ventricular systole. Here is ventricular diastole. Again, next cycle ventricular systole, ventricular diastole. So first heart sound will be here, S1, right? But first heart sound will have two components. What are the two components? The earlier component is M1 and later component is tricuspid. Am I clear? Yes. Right, but there is very little separation. In 50% of the patients, you may hear a single sound. Right? This is one thing. This is first heart sound. Now, ventricle keep on contracting. As soon as ventricle started contracting, these two valves closed. But ventricular keep on contracting and squeezing the blood in their chambers until intraventricular pressure becomes more than major arterial pressure, and when left ventricular pressure becomes more than pressure in root of aorta, aortic valve will open. And almost same time, when pressure in the, what is this? Right ventricle becomes more than the pressure in root of pulmonary artery, which valve will open? Pulmonary valve will open. So again, ventricular systole start, first closes which sounds? Valve? Mitral and tricuspid, and generates vibrations for first heart sound, and then it keep on rising intraventricular pressures until pressure in ventricles become more than the pressures in major arteries and opens the aortic and pulmonary valve. And when aortic and pulmonary valve open, which sound is produced? Second heart sound. Absolutely wrong. Write it down. In healthy heart, valves open silently. In the healthy heart, valves should open silently. Look at it. Let's suppose this is aortic valve. This is aortic valve or any valve. Okay, I was saying this is suppose aortic valve. When it opens, there is no sound, but when it will close, it will produce sound. It's so simple. Is that right? In the same way, mitral valve. Mitral valve, when it opens, it doesn't produce sound. When it closes, it slap and produce sound. So it's a very basic cardiology concept. It is the first thing you should know when you hold a stethoscope in your life. That in a healthy heart, usually the sounds are produced by valves closure, not by opening. Remember your door in your bedroom. Opening of door may not produce sound or should not produce sound. Closure may produce sound. Is that right? Or just look at it. My hands. Opening is not producing sound. Closing is producing sound. Is that right? Yes. So again I will repeat my question. Yes. When ventricles start contracting, pressure in the ventricles go up, as soon as pressure in the ventricle is more than the atria, atrioventricular valve close and produce vibrations which will produce first heart sound. Then after production of first heart sound, right, ventricles still keep on contracting until pressure in chambers of ventricles become more than pressure in root of major arteries, and aortic and pulmonary valve open, producing which sound? No sound. Very good. And if opening of these two valves is producing sound, these are called clicks. Healthy valve should not click. Should not click. Am I clear?